When then Senator Barack Obama said, if you like your health care plan, you can keep it?
If you've got health care already, and probably the majority of you do, then you can keep your plan. If you are satisfied with it, you can keep your choice of doctor. We're going to work with your employer to lower the cost of your premiums by up to $2,500 a year.
Well, that sounds good, but it didn't happen. Joining us right now is Senator Ron Johnson of Wisconsin. Senator, you wrote an op-ed in the Wall Street Journal, and the final item in it is you say that whatever you call it, it was a doozy, Mr. President. What are you talking about?
Well, that estimate that the CBO, well, first of all, the president did say if you like your health care plan, you can keep your health care plan, period.
Right.
Nobody's going to take it away from you no matter what. And that's just outright not going to happen, because Obamacare totally changes the equation in terms of how employers are going to be looking at purchasing health care. And, the CBO estimated that on net, only 1 million individuals would lose their employer-sponsored care. And that's out of about 154 million people that get their health care through their employer. But the problem is now in 2016, a family plan will cost $20,000 versus paying the $2,000 penalty, and you're not exposing the people that work with you to financial ruin,
right,
because now you're making them eligible for huge subsidies in the exchanges. $10,000 if your household income is $64,000. So,
right,
I don't know too many federal subsidies that go unused.
Well, let's take a look at what we were promised and what the reality is. Back in 2008, President Obama said the plan would lower premiums by about $2,500 by the end of his first term. In reality, look at this. Premiums have increased by about $2,200 per family. What happened?
That's a $4,700 difference.
Yeah.
The problem is all the mandates. The administration is great at saying this is going to be free. Now seniors have free preventative care. Now, children up to the age of 26 get free coverage. Nothing is free. You just shift the cost onto somebody else. And my concern, Steve, is, what's going to happen, and I think this is exactly the way this health care law was designed, is that pretty soon everybody will be forced in the exchanges. We're going to basically have a de facto single-payer system, and the federal government simply can't pay for it.
Right.
It can't pay for Medicaid. It reimburses providers at under their providing cost, which is why in some places only 60% of providers actually see Medicaid patients. That's what we're facing here.
And, Senator, when you talk about how this particular bill was designed, you say there are some gimmicks in it, including the Class Act. For instance, the Congressional Budget Office in 2010 said that the plan would reduce the deficit by $143 billion over 10 years. That sounds great. But in October of this past year, the president and his health care secretary did away with the Class Act, which wiped out about $70 billion worth of the projected $143 billion savings. You say they knew going in that the Class Act was not going to work, and that was just a gimmick to sell it.
Sure. Budget Chairman Ken Conrad, he called the Class Act a Ponzi scheme. The president just included in his budget another $111 billion for the exchanges, which, chips away at that supposed deficit reduction. But, the real doozy in terms of that sleight of hand is the fact that they actually said they were going to reduce Medicare by $529 billion. They haven't reduced Medicare or payments for providers by the $208 billion under the SGR. What makes anybody think that they're going to do that with the $529 billion? This thing is going to add hundreds of billions, if not trillions of dollars to our debt and deficit. We simply can't afford it, Steve.
And real quickly, you would know something about that. You were in a small business. You owned one for 31 years. If you were sitting in that chair instead of being a senator these days, you'd be faced with, you know what? This is really going to be expensive. I think I'll just pay the fine.
Well, you're also faced with having to comply with now 15,000 pages of the law and the rules and regulations. And, Steve, they've only just begun. You talk to providers, you talk to health insurance companies. They don't have a clue how to actually implement this. The government doesn't know how to implement it. My current mission is to paint a picture for the American people of what our health care system, our freedoms, and what our federal budget is going to look like if we fully implement Obamacare. It'll be a disaster. Let's hope the Supreme Court does the right thing.
Well, happy anniversary Obamacare. Today it is 2 years old. Senator Ron Johnson from Wisconsin. Thank you, sir, for joining us today.
Thanks for having me on.
You bet. All right.